Hi there, I'm Dr. Brigid Norton. You can call me Brigid. This is Menopause Bites, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, let's talk about menopausal hormone therapy and what it's good for in perimenopause. Let's start by clarifying terms. When you hear hormone replacement therapy or hormone therapy, what is actually meant is menopausal hormone therapy. And that's important because menopausal hormone therapy is designed for menopause, not for perimenopause. Now you might be thinking, wait, menopause, perimenopause, isn't it all the same? No, it's not, and here's why. During perimenopause, your estrogen and progesterone levels are unpredictable. They swing dramatically up and down. If you're watching this episode, you will see an artistic rendering of hormones across your lifespan. If you look at the perimenopausal segment in the middle, you'll notice that there are extreme peaks as well as valleys of hormone levels, especially estrogen levels. And it is these swings, including the peaks, not just the low points, that likely play a big role in some of those perimenopausal symptoms you're experiencing. Menopausal hormone therapy doesn't stop these swings. It actually adds to hormone levels on top of what your ovaries are already producing. Menopausal hormone therapy can definitely smooth out some of the lows, but it doesn't stabilize the bigger picture. In fact, it may actually intensify your symptoms by making those peaks even higher. That's why hormonal birth control is often a better choice during perimenopause. Many birth control options work by temporarily shutting down the ovaries, replacing those hormone spikes and dips with steady, predictable levels. Options like the pill, the patch, or the ring, which contain both estrogen and progesterone, can effectively manage perimenopausal symptoms, but in addition, also prevent pregnancy and regulate your period. Progesterone-only options like the implant or certain progesterone-only pills also work by turning off the ovaries, preventing pregnancy and managing your period, and they can be paired with an estrogen patch to stabilize your estrogen level. So hormonal birth control can really be a powerhouse option during perimenopause. Now, not everyone can take hormonal birth control, and in those cases, menopausal hormone therapy can be an option. But again, it's usually less effective at stabilizing all of your symptoms during this phase. For either approach, I usually recommend a 3 to 6 month trial to see what works, and I always suggest keeping a symptom journal to track your progress. It's also important to be realistic. Not every symptom you're experiencing, like brain fog, joint pain, or weight change, is purely hormonal. Lifestyle factors, aging, and medical conditions also play a role. Hormones can certainly help, but they are not a magic cure-all. Now, about menopausal hormone therapy specifically, it's FDA approved for only 4 things. The first is to treat vasomotor symptoms or hot flashes and night sweats. It's also approved to treat low estrogen in the vagina and surrounding areas, to prevent bone loss, and to manage premature menopause. That's menopause before the age of 40. It is not approved to treat things like sleep issues, mood swings, or brain fog. While it might help with these and other issues, there's no guarantee it will. And despite what you might see online, menopausal hormone therapy does not prevent dementia, heart disease, or other age-related conditions when started in perimenopause. Those claims often confuse research in starting menopausal hormone therapy early in menopause, which does not apply to perimenopause. Perimenopause really requires a different strategy, and hormonal birth control is often the best choice for balancing symptoms during this phase, while menopausal hormone therapy becomes more relevant closer to and after menopause. So that's it for another episode of Menopause Bites. Here are some take-home bites to remember. Menopausal hormone therapy is meant for menopause and not for the hormonal roller coaster of perimenopause. For symptom relief during this phase, many hormonal birth control options outperform menopausal hormone therapy by stabilizing hormone swings. And menopausal hormone therapy has no data for disease prevention in perimenopause. Until next time, may your hot flashes be bearable, your nights restful, and may you keep your cool no matter what your hormones throw your way.